Big takeaway of the budget 2021 are right here on your television screen. So there is a 137% hike in health allocation, which is the highest yet. So the focus is of public-private partnership in the health sector. That is what the government is aiming for. 64,180 crore Atmanirbhar Health Yojana is what the government is saying to make the health sector self-sufficient and self-reliant. Again, another focus, because this is the budget in the times of pandemic, the focus, of course, is on the COVID vaccine. 35,000 crore allocated for COVID vaccine, 2 of which has already been rolled out. The focus is again on the big infrastructure push. This budget is being called as infrastructure-rich budget because for highways, metros, all that is being highlighted. 1.93 lakh crore is what Finance Minister Nirmala has given in this sector to highways in Tamil Nadu and other states down south. Phase 2 of the Chennai Metro will be at 63,000 crore. This, of course, is significant again. FDI insurance has been hiked from 49% to 74% is another big takeaway of Nirmala Sitharaman's budget. All divestments to be completed by 2022. So the government is setting timelines again in this budget as well. 2.5 lakh crore paid to Kisan for wheat, rice. This is, remember, Nirmala Sitharaman had announced 5 such packages during the initial months of the pandemic in the last 9 months, particularly keeping the Kisan or the farmers in mind. Tax relief for senior citizens above the age of 75. This again is coming as a big relief for them. So the big takeaway is of no double taxation for NRIs, some relief for the NRIs too, coming in this budget that has been presented by Finance Minister Nirmala Sitharaman. The big focus, as we are living in the times of pandemic, of course, is on health. Let's listen in to what Finance Minister had to say, particularly announcing that aspect of health infrastructure.
PM Atmanirbhar Swasth Bharat Yojana will be launched with an outlay of about 64,180 crores over 6 years. This will develop capacities of primary, secondary and tertiary care health systems, strengthen existing national institutions and create new institutions to cater to detection and cure of new and emerging diseases. Setting up of 15 health emergency operation centers and 2 mobile hospitals. The National Infrastructure Pipeline, which I announced in December 2019, is the first of its kind. Whole of government exercise ever undertaken by Government of India. The NIP was launched with 6,835 projects. The project pipeline has now expanded to 7,400 projects. Around 217 projects worth rupees 1.10 lakh crores under some key infrastructure ministries have been completed. National highway works in the state of Tamil Nadu at an investment of 1.03 lakh crores. Second, 1,100 kilometers of national highway works in the state of Kerala at an investment of 65,000 crores. Third, 675 kilometers of highway works in the state of West Bengal at a cost of 25,000 crores in the state of Assam. Further works of more than 34,000 crores covering more than 1,300 kilometers of national highways will be undertaken in the state in the coming 3 years. I propose to amend the Insurance Act 1938 to increase the permissible FDI limit from 49% to 74% in insurance companies and allow foreign ownership and control with safeguards. Under the new structure, the majority of directors on the board and key management persons would be resident Indians. Fiscal deficit in RE 2020 to 2021 is pegged at 9.5% of GDP. We would need another 80,000 crores, for which we would be approaching the market in these 2 months. The fiscal deficit in BE 21-22 is estimated to be 6.8% of the GDP. We plan to continue with our path of fiscal consolidation and intend to reach the fiscal deficit level below 4.5% of the GDP by 2025-2026, with a fairly steady decline over the period. I have also provided, on the Commission's recommendation, 1,18,452 crores as revenue deficit grant to 17 states in 21-22.